The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host Kimberly Bermel, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you on the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' remarkable recovery stories. In today's show, I'll be joined by my American Medicine Today radio co-host Ethan Euchre as we speak with Dr. James Hubbard, a survival medicine expert and author who spoke at length about the threat that Ebola poses to Americans. And then we'll hear from Sal Pain of BioRecovery, a company contracted by the government to perform Ebola waste cleanup. He'll explain how they're handling the cleanup and also give us his opinion on the threat we face as Americans. Next, we'll hear from a patient who received the patented and exclusive Bonati spine procedures from world-renowned orthopedic surgeon and founder of the Bonati Spine Institute, Dr. Alfred Bonati. We'll hear about their remarkable recovery from them personally in our Back to Life segment. Then, I'll chat with Dr. Bonati one-on-one about Ebola and the ongoing troubles with Obamacare and how you will be affected. Introducing our first guest is radio program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thanks, Kimberly. Every Saturday at noon, we are joined by interesting guests who shed light on the growing concerns many Americans have about their medical care.
Today, we'll highlight the recent Ebola cases in the U.S. and how many Americans are afraid that an outbreak or epidemic is looming in our country. We've brought in two different experts on this very serious topic.
That's right. We'll speak with Dr. James Hubbard, a survival medicine expert and author who spoke at length about whether Ebola truly poses a threat to Americans. Then we'll speak with Sal Pain of BioRecovery, a company contracted by our government to perform Ebola waste cleanup. We'll hear how this dangerous task is being handled. Should we be worried? Let's find out.
We're here with Dr. James Hubbard, a survival medicine expert and author. Now, not only does he have a few books out, and we'll get to that in a little bit, but specifically, we have him here to discuss the Ebola situation. Certainly, we have heard that it was no big deal, and then we've seen in recent weeks that some of the crew that was first responding to the initial Ebola patient have come down with Ebola. So, do we need to have ourselves on alert?
Should we have a plan in place? He is the survival doctor, Dr. Hubbard.
I think you ought to be aware of it. You ought to know that it is a horrible disease, and then you should do what you want to do, keep up with the news, and then just live your life.
With that said, Dr. Hubbard, not to make things too simplistic or to go overboard in a scare tactic, but let's recap the ways that one could attract Ebola and then the things we can do to prevent that from happening.
First off, we've had one person come from the other country that has had Ebola. We've had other scares. Sure. People have been isolated. That one person that came there, I just think it was expected, and there's going to be expected that several others are going to have Ebola once they get here, with noting that the air travel and noting people can get here in various ways, and that there's an incubation period before you start getting sick or getting symptoms or getting contagious or being able to really tell if you have it or not. Well, there are going to be some other people coming.
And how do people contract Ebola, I think is what Kimberly was also asking. Is it airborne, bloodborne?
People say it over and over again, and then other people, you get it from direct contact with bodily fluids. There's been no evidence of any sort that it is airborne like the flu or something like that. And you can do with it what you want, and you can go in your house and stay there, or you can say that's not true, whatever. But I think people have to be practical, and again, like I said, we have to live our lives, because there's always some infection. This one's a horrible one.
What are some of the symptoms, Dr. Hubbard, that you're aware of that people will start to come down with, so that we can all be aware if we see something like that, maybe to take notice? And
somebody who has fever, vomiting, and abdominal pain, diarrhea, and who's going to have that? A fourth of the population of the United States here, with the flus and the viruses and everything going around. Another thing, though, that you need to know is, have they been exposed to somebody direct that has had Ebola within the last 21 days?
And Dr. Hubbard, I want to talk about treatment for a moment. A lot of people say that it's more your own immune system has to basically fight it off in order to survive. And then other people say that, well, there is treatment that's being worked on and developed. What do you know about it, and what are your thoughts on treatment for Ebola?
I think you got to look at viruses in general. In general, there's no good treatment. There's nothing like an antibiotic that kills a bacteria. There's just no good treatment for them. Our bodies have to have time to live through this, our antibodies and everything to fight it off.
Well, thank you, Dr. James Hubbard, for joining us about the Ebola scare, and certainly we'll be reaching out to you as more information becomes available and we see how this thing progresses.
Thank you, and you can check out my website at thesurvivaldoctor.com.
We're here right now with Sal Pain. He's actually calling us from the car, but he is the foreman and chief safety officer for BioRecovery Corporation. And his company has been contracted to deal with this Ebola waste, including the quarantine planes at JFK. So with that said, thank you for being here, Sal.
Thanks for having me on again today.
You know, what a difficult job it is that you have doing this cleanup, because I think even on the write-up, it had said the government doesn't even want any responsibility having to do with this scary Ebola cleanup.
They don't want the liability involved. So our own government won't even take over the cleanup of this waste. So
kudos to you and your company for taking it upon yourself to keep us safe. Why don't you start to explain how it is that you do your job?
Well, for the past 20 years, we've been doing situations like this. We've been contracted by the government because, like you said, the government does not want to touch this, quote unquote, with a 10-foot pole. The liability is absolutely through the roof. We continue to do it. We've done it with them for 20 plus years, from the anthrax in New York City to different types of pathogens and bacteria that have actually outbroken throughout the years. Some you may have heard of, some you may not have heard of. It's a part of our day-to-day life. It's, you guys go into your job every day. We do the same. The only difference is we wear a suit that's a quarter of an inch thick.
So we were looking at a picture, and we actually saw somebody that was part of a cleanup crew, not necessarily your corporation, so we want to preface this by saying that, but they were speaking with a reporter, and the reporter themselves was just in plain clothes. Wouldn't that be cause for concern?
We've critiqued the cleanup company over in Texas many times with government officials, state officials, media. I can't condone to what they've done. I mean, watching what their standard operating procedures were unethical and off protocol, to say it lightly. To see them not quarantined after a cleanup, they were in direct contact with one of the most dangerous viruses known to man. And 20 minutes after they were done with their job, they were on TV on camera. Our men and women, after we do a cleanup, will be quarantined for a specific amount of time. Blood samples would be taken and temperatures would be read multiple times. They would be under full medical surveillance until they're cleared to go home to their friends and families.
Well, I understand that your company, BioRecovery, are going to be responsible for quarantining and cleaning up some of our military as they return from some of these countries over in Africa, correct?
Absolutely. We're working directly with the U.S. government and the Army Corps of Engineers and the Army to set up decontamination processes and make sure that all of our men and women that are coming home get, clean, disinfected, and properly medically surveillance so that they don't return home and contract the disease the virus to other people.
Sal, can you just kind of walk us through real quick the actual process that you folks use at BioRecovery? You talked about the suits that you had, these Class A suits. What do you do with the waste when it's done? Because something that is one of the most highly contagious things known to man.
Where does it go?
Where does it go?
It's not going in my backyard, I'll tell you that much. Right now we have an approved medical waste stream, it's called. We have an approved medical waste stream going from wherever the site is, which is called a cradle-to-grave method. It goes from wherever the site is to the grave, which is wherever it's completely incinerated at. We have an approved method with the DEC, the EPA, and the Department of Transportation to transport it from wherever it is going, wherever it's coming from, to a facility of an undisclosed location. Once it's incinerated at several thousand degrees, it has no remnants whatsoever. It is completely unrecognizable. There will be no DNA characteristics left inside of it. It will be 100% safe. And at that point, if they'd like to bring it in my backyard, they can bury it in there for no cost.
Kudos to you and to BioRecovery Corporation for taking it upon yourselves to help with the cleanup. Again, we've been with Sal Pain, Foreman and Chief Safety Officer of BioRecovery Corporation. At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs and our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeons more access to their patients and allows you to go home the same day. We'll be right back to hear from a Bonati spine procedure recipient in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The patented Bonati spine procedures are leading the way in minimally invasive spine surgery exclusively performed here at the Bonati Spine Institute. A recent 7.5-year survey shows a patient satisfaction rate of 98.75%. Now you'll hear from one of our patients in our Back to Life segment.
My name is Burthrum Hinds. I was a previous patient here at Bonati Institute. In 2002, I had a herniated slip disc, and I happened to find out about this institute having a problem since 1998. Went to all types of chiropractors, physical therapy, and whatnot. And then I finally decided to have the operation, the surgery. I came down here in Hudson, and what impressed me was the photo gallery. Seeing all the footballers and race car drivers, and so I say, if they can come here and get operated on, do surgery, well, this had to be the place. So I did surgery, and it was fantastic, unbelievable. I cannot say more. That complaint was a herniated slip disc. I got it through an accident. And that night, following the surgery, I lay on my stomach, no pain. I didn't have to take no medication. The next day, I went for a walk in one of the malls, and that was it. Until now, 2012, I'm here presently, not for the same. This time, I came back for a pinched nerve in my spine, between 4 and 5. Oh, the pain was excruciating. I couldn't walk. I was walking with pain. I'm limping. I couldn't walk from where we are, from here to the door, but it was a total disaster. Pain all the way down in my leg, all the way on my hip. When people see a pain in the neck, I realize what they mean.
They're going to get a good prognosis. If they have pinched nerve pain, there are good chances that we can eliminate the pain or make it tolerable so that they can go through normal activities of daily living. People don't come here to be patted on the head or to be given medicine. People come here because they have pain which is truly affecting the quality of their life. being able to have a positive impact on that pain is very rewarding.
Again, I went to physical therapy, I went to an orthopedic surgeon, I went to a chiropractor, and I said, everybody wanted to recommend pain management. Over time of pills, and I said no, because I am too active. Okay, I have to walk 3 miles every day because of a heart problem that I have. And I walk very fast, 15 miles a minute, 15 minutes for a mile. So 3 miles, 45 minutes. And if I couldn't do that with pain management. So here I am. I came back to the source that did me right. I waited, I said, I want this surgery to be done by the boss, the man who invented it all, this procedure. And I got him, and he is fantastic. I'm here, as you see, as a patient in the Bonati Institute. I had surgery yesterday, and I'm ready to leave today. Had surgery on Wednesday, today's Thursday.
The patients get up, there's so little recovery time, they are happy, they are pain-free. That's the key, and they get their lives back.
3 days ago, I felt like an old man. I'm 82. December, I'll be 83. And I just cannot crawl. So I came here again. I'm speaking this way, nobody's prompting me. And you see me smiling because I'm happy that I'll be able to get out there and do my thing. I feel good like James Brown. I feel good. Pain is something else. And when you could eliminate pain, you can come to the root, to the place where they can help you. Do it without a doubt. He is the best. That's the bottom line. I recommend this place to anybody. As a matter of fact, I have been recommending Bonati Institute. Back to my walking, 15 minutes a mile.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done, and we can correct that.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
It gave me my life back.
I am feeling great.
I feel 100% better, like a new person.
I'm pain-free, and I have had to take any pain medication.
Today I'm completely pain-free.
I only wish I'd known about it earlier. Right now I am completely without pain.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible.
Today I am pain-free for the first time in over a year, and it is so awesome.
It's just wonderful.
I feel fantastic.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
It is just absolutely amazing.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
So I'm hoping to be climbing hills in a few weeks.
When I first met him, and he reviewed the MRI, and was, while reviewing the MRI, was saying, you have a problem here that gives you pain. It should have pain here. And it's like, well, exactly. Well, I've had a lot of people ask me about my back. And when I explained to them that I'm virtually pain-free, I have recommended, since my surgery, 3 people to Dr. Bonati. And my comment to them was, it worked for me. You need at least a consult. Get an MRI, get a consult.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Dr. Bonati regularly voices his disdain for Obamacare in our TV program. Some viewers agree with him, and some voice their displeasure with his opinions. Now, Dr. Bonati is proud to call himself an American citizen and proud that he can voice his opinion in a public forum. He doesn't do this for fame or for recognition, but to try and educate viewers about the trouble he's seen with similar types of medical systems in countries he's lived in and witnessed firsthand.
He thought you may find it interesting to hear about Americans and how they've become desensitized about their medical care. So I'm here with Dr. Bonati, and there has been such a scare with this Ebola virus. Dr. Bonati, what do you think about what's happening right now with Ebola? Is it something we should be that concerned over? And what are your thoughts on the disease itself and maybe what the government needs to do to prevent this from really becoming a pandemic?
Let me try to put this thing in a different perspective. I think we know a lot about Ebola. I think we know the type of virus, but what we don't really know is how this infection can be transmitted. What really bothers me is the lack of responsibility on the government. I can tolerate mistakes. Everyone in this type of situations have mistakes or create or has possibility to create mistakes. But don't lie to the people, because lies to the people by the bureaucrats or by the president are extremely dangerous. One of the problems is when you said that this infection is not going to pass the frontiers of the United States. It's not going to come to the United States. And then you find, yes, it's in the United States. When you talk about transfer of this infection, and then you said the transmission of this infection is through body fluids, and then you come over, no, it's not. Then that means the CDC and the individuals in charge of this, they don't know.
You know, I just read something in the news that talked about how the CDC just said it is airborne. So doesn't that cause more concern?
Well, the problem is, the concern is there. What I don't understand is why this government has so poor common sense. Everything that they do, I don't know if the Democrats or the individuals that they are in charge of this political arena today, in command of the country, they are individuals that they hope that everything will be easy to correct or easy to solve. The problem is not only they lie, but at the same time they have no direction. And the worst part, they take directions that they are not really clear. The common sense will be, you close the frontiers. You need to close the frontiers. Common sense will be, any country who is contaminated is going to be studied as a country who has the contamination, we can help, we can send volunteers there, and we can send people who can help them, but it's contained. It is contained. It's a laboratory of the world where we can go and work. It's not common sense to allow these people to come here and start to create a laboratory of the Americans that they can be contaminated. That is absolutely insane. This is what this government constantly do in everything. They do healthcare, totally shooting from the hip. They are not prepared to do anything. They do a disaster, and they are not responsible. And now, it's really important that this healthcare crisis is now being seen by the whole country. This crisis can be controlled in all these other countries, okay? And at the same time, are you telling me that you are sending 4,000 recruits there, 4,000 soldiers, that they are going to be exposed to this? And what they said, oh, they're going to have masks and gloves. Are you crazy? You see this nurse who that contaminated with all the outfit that she had. And then when she is contaminated, the CDC allowed her, because she talked to them, and they allowed her to go in a commercial plane. Thanks God I stopped that. But you know, they go and they say, okay, yes, you can fly in the commercial, it's not a problem. Well, the problem is, we don't know how many other people got involved in this now.
Correct.
Then the same system is become, like you said, is spreading, and they don't have answers.
Thank you for watching American Medicine Today. If you have any comments or questions, please feel free to contact us at the number below. When you do, please make sure to leave your name and number. If you have a Twitter account, you can tweet at Dr. Bonati or hashtag American Medicine Today. Now, if you're a doctor or a medical innovator and you would like to be featured on our program, please email request@americanmedicinetoday.com. We respect your views and opinions and would like to hear from you.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The preceding program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.